Hi you guys, this is Dr. Tahir from Family Pediatrics, and thank you so much for joining me this morning. I was sitting across the mall drinking my coffee and reading for a little while before going to the office, and it came to me that this might just be the perfect time for me to do a talk for you about the big bad 4 bugs of winter. I've been wanting to do this for a little while, and before I get to the office and get swamped with all the work, I thought this may be just a perfect time, even though I'm sitting in the car. I'm not driving though, okay? I'm parked safe and sound. So today I'll be talking to you guys about the big bad 4 bugs of winter, okay? These are the illnesses and bugs that cause these things. So strep throat is a big one that your kids may catch, unfortunately, during the winter time. Influenza is the other big one that we see all the time with kids. And then there is the bad RSV virus that also causes havoc in our lives. And then pertussis, or whooping cough. This also is one that causes a lot of illnesses in the winter time. So I'm going to talk to you guys about all of these 4 bugs, the big bad 4 bugs of winter, so you guys know what the differences are and what to look for your kids, all right? This talk is actually good for you as a parent, but also I'll be using this for training for my staff and everybody. So let's look at strep throat. Strep throat is a bacteria that's contagious, so if somebody has it, somebody else can catch it. Very important to wash hands really well and cover your mouth when you're coughing when somebody has strep throat. Main symptoms of strep throat is sore throat that all of us know about, but also headache and tummy ache and fever. All right, sore throat, headache, tummy ache, fever. Those things spell strep throat. Sometimes kids come in and they don't even have a sore throat, but they have other things going on. Strep throat can often cause rashes also. Okay. It causes a lot of sore throat, but it doesn't make the person feel super tired, and usually will not be causing coughing and runny nose and sneezing. Those are other kinds of viruses that will do that. So remember, strep throat, headache, sore throat, stomach ache, and fever. All right. Nice thing about strep throat is that when you get on the right antibiotic, it gets better very quickly. Now here's the important thing. Your child will get better before the antibiotics are done, but it's super important to take all the antibiotics for the full course so that the bug dies off, okay? Let's talk about influenza, and that is our next bad bug of winter. Influenza is also called the flu, and the type of influenza or the flu that we're talking about is the respiratory kind, the one that causes coughing, sneezing, and runny nose. Not the stomach flu that people talk about that causes diarrhea and vomiting. That's not this flu, all right? When kids catch flu, and this winter has been just horrible for this, they usually get sick very quickly. Parents might note that the child took a nap and they woke up and they have this huge fever and feel terrible. Influenza bug makes you feel super tired and just drains all the energy out of you. Last year I caught influenza and I felt like I got hit by a truck. So just imagine what the poor kids go through. So the main thing for influenza is that it causes fevers, usually a headache, and makes you feel super tired and gives you body aches, okay? And that is influenza. If you catch it early enough, there's an antibiotic for it that I can prescribe, or doctors can prescribe for your kids, and that antibiotic is called Tamiflu. The earlier it's taken, the better. Ideally, within 2 days of starting to get sick, you need to be on that antibiotic. So if your child is sick, call your doctor right away. And if they can't get you in, and usually we do, always get you guys in, but if your doctor can't get you in, ask them if they would treat for influenza based on what some of the symptoms your child may be having. All right? Best way to help decrease transmission and of influenza and catching influenza, get your flu vaccine, please. All right? So nothing is 100%, neither is the flu vaccine, but it helps to decrease getting and transmitting influenza. So do that, okay? All right, let's talk about bug number 3. This is the famous RSV virus, all right? I hope you guys can see that. I'm trying to get the glare away. RSV virus is the other bug for the winter time. And this bug causes a lot of havoc for little kids. It's a cold virus, and it can affect kids and older kids and adults. But the younger the child is, the more severe illness they'll get. And this causes severe coughing and congestion for babies. Sometimes it's so bad that the babies can't breathe or drink, and they need to be hospitalized because of that. Some babies have a lot of wheezing and breathing problems. The illness it causes in babies is called bronchiolitis, okay? Not bronchitis, but bronchiolitis. And this illness can last for a long time. There aren't very good treatments for this. There are some medications that help, but even with all the right stuff, the illness can go on for a good 2 or 3 weeks. And usually kids get better very, very, very slowly. So I tell parents, don't worry, your child's getting better. We need healing time, and little by little, things will get better. Usually RSV gets worst at day number 5. Okay, so the younger the kids are, the more difficulty they can have with this virus. Older kids and adults might just have a plain old cold from this, just like any other viral cold, for example. There is a vaccine available for this. It's used only for premature babies or babies that have other medical conditions. It costs about $1,300 per shot, and it's given every month during the fall, winter, and springtime to prevent those kids from getting sick, because if those kids get sick, there can be some very disastrous consequences for those poor little babies. All right, let's talk about pertussis. Pertussis is also known as whooping cough, okay? Whooping cough, people think is old news, an old world disease, but not the case. It's all over the place, and we all hopefully get vaccines for it. But the vaccine isn't 100%, and the vaccine effect wears off as time goes on, so lots of adults can catch pertussis and pass it on to babies who aren't immune to it. Pertussis is a very severe coughing disease for little kids. The older kids and adults can have a lot of coughing too for weeks or months. That takes a toll on the body. Eventually gets better, but the younger kids, it can be just devastating. And I've seen it with my own eyes in little babies, and I hope to never see it again. So there's 2 different kinds of coughs that kids can get. And when kids do come in with cough, sometimes I'll ask parents, what does their cough sound like? All right, cough number 1. That's cough number 1. Or is it cough number 2? Cough number 2 is pertussis, all right, or whooping cough. So kids can cough, 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 cough. They can't breathe, they can't talk, they can't do anything. Some kids turn blue and gray. And some of the older kids, after they cough, they take a deep breath and go, and that's called the whooping part of the whooping cough, okay? But the little babies aren't strong enough to make the whooping sound. They'll just cough their little lungs out. And sometimes things get so bad that they need to be intubated, where they have to be on a machine with a respirator or breathing for them until they heal up. So it's a very disastrous illness, and important to get your kids immunized for it, and as adults also be immunized for it to protect the little babies. All right, so I hope you've enjoyed today's talk on the big bad 4 bugs of winter. I see these all the time in the office, and I bet your kids may suffer from these also at some point. If your doctor talks about them, then you'll know what you're talking about. All right, have a great day. Thank you so much for joining me today.